Are we ready? I'm Dr. Jerry Johnson, and I want to talk to you about a topic related to lung cancer, but I wanted to broaden the discussion beyond just lung cancer and broader than just cancer in general, to talk about successful aging in the context of overall health for persons who do have lung cancer. One of the reasons why I'm focusing on aging is because that's what I do. I'm chief of geriatrics at the University of Pennsylvania Health System, and a lot of my time and energy is devoted to trying to improve the health of underrepresented minority populations as it relates to cancer and other illnesses. So I'm going to talk about successful aging. I'm curious what any of you, all of you, of course, look so young, and one's definition of what's aging and what's a senior can vary anyway. I'm curious how you even think about aging, or what is it? What's the word mean? Anybody? Yeah, when you think about aging, what do you think about? How would you know when you have it and when you don't? I just need one answer here, anybody. Whatever you say, I'll make right. Don't worry about being wrong. Just, what's that? Your face changes. The face changes, yeah, there definitely are physical changes that occur with aging, getting shorter. You know, my hairline's receding. My wife's trying to help me work on that, but not that she's making it fall out, I don't think, but in any event, there clearly are physical changes, but there are others too that we can talk about. Some of it is a concept and a philosophy, though. I remember when I was training in residency, and I distinctly recall taking care of a 55-year-old woman and thinking how old she was. She was sick, she had on a gown, she was in the hospital, and I remember seeing her about a month later after she was out of the hospital, and she had on her street clothes, and her hair was fixed, and she looked so much younger. And that was one of the first lessons that I remember about how aging is more than physical, but also one's environment and how one feels about oneself. There's a philosophical aspect too. Now I'm convinced that aging is at least 15 years older than I am at any point in time. So that way I can not catch up. Not catch up with the process. But we do think of aging as a process. It's multifactorial, it's not fixed in time, it's influenced by several variables. And what I want to talk about a little bit is what is aging, biological and physical, successful. What do you think about to be successful as you age? What do you think you have to do? What do you think would be included in that? Diet, eating, what else? Exercise. Exercise, what else? Self-acceptance. So there is a kind of spiritual component having to do with how one sees oneself, one's relation to the world, meaningful existence. Absolutely, all that's part of successful aging. But with time, it's not uncommon to have major diseases, so I want to talk about what some of those are. And persons with cancer, one of the things that we find in contrast to what we see with young adults who might just have one major health problem, it's not uncommon after age 65, and particularly when you get into 75 and 80, it's not uncommon for there to be multiple comorbidities, so that the person with lung cancer may also have other major diseases. And some of those major diseases are those you know about. Cardiovascular, certainly, such as stroke, heart attacks, heart failure, lung disease, dementia, depression, which can be overlooked in our communities, and partly because of some sense, I think, of a stigma, but also misunderstandings about what these illnesses are. And then there's the issue of promotion, health promotion and prevention, which should not be discounted overall just because a person has a cancer. So this is how we in the field of aging think about biological and physiological aging. One fact that's unequivocally is that humans don't live indefinitely, and function does decline with time. So how would you define aging? Can we define it? One very specific biological way of defining aging is the decreased ability of cells to multiply. And that's established very clearly. So if you put cells in a nutrient environment in a dish, they'll start multiplying. And they'll continue to multiply, but they'll multiply a finite number of times. They don't do that indefinitely. To the extent that cells multiply indefinitely and climb all over each other, then they're acting like that's what cancer cells do. But normal cells multiply a finite number of times, and they do so in an orderly fashion. And we can find some evidence of that at the organ level also, the heart, the kidneys, the lungs. I'll give you some examples of what those may be. The challenge with aging is to distinguish what is a biological process from the influences, that is disease and environmental influences that are external. And to some extent, that's a technical measurement issue. This is how, in relation to how organs function overall, this is one way that we think about physiological aging. One is the ability of the body as a whole to consume oxygen. And we can do that, we can measure that while persons are exercising. In the heart and the cardiovascular system, it's the capacity of your heart to pump effectively. So a person who is 25 compared to someone who's 75, at rest, their cardiac outputs are similar. But in response to stress, if you put both of them on a treadmill, the person who's 75 is not going to be able to generate as much of an increase as the person who's younger. So one way we think about aging is the ability to respond to stress. In this case, the stress is output. This issue related to kidneys is quite relevant to persons who have serious illnesses. For example, someone who has a cancer, because during stages of the illness, either because their persons are being treated with chemotherapy, or it may be just because they're beyond that stage and the illness is advanced, there's a risk of dehydration, right? There's a risk of dehydration. And we're mindful of making sure and trying to ensure that our loved ones with cancer are getting food and getting calories, but it's actually the fluid intake and the potential for dehydration that's a greater threat, and that can occur quickly. Even in the absence of disease, older adults have some challenges holding on to salt and holding on to water compared to younger adults. So for example, if you drink 20 gallons of water a day and you have normal kidneys, they're just going to excrete it. They're going to excrete that excess water. If you take in extra salt, they're going to excrete that excess salt. Now you may be taking some medications that interfere with that, but that's how normal kidneys work. On the other hand, with age, the efficiency of that ability to hold on to or excrete excess salt and water are changed. So what does that mean? It means the caregivers have to be that much more attentive themselves. This becomes a big problem sometimes I see in nursing homes where persons are waiting, the staff are waiting for an older adult to ask for water when they need to give it on a regular basis. I'm going to skip the lung and respiratory function because there's been, I think we're talking about it, they've been talking about lung and lung cancer already. And they're not, in the absence of diseases like emphysema and other types of lung disease, the normal physiological changes in the lung with age are not really significant. There are some changes related to hormones that are, though. So you know what diabetes is. Diabetes refers to glucose tolerance and the ability of the body to in a simple way to manage and handle glucose efficiently. That is, to take it up when it's circulating in the bloodstream and to use it appropriately. That uptake by cells, whether we're talking about muscles or the liver or the brain or any other cells, is not as efficient with age, and therefore can result in at least a tendency toward diabetes. The blood vessels can be stiffer. How's this relevant to kind of health or someone who's being treated with lung cancer? One way is a greater likelihood, if the blood vessels are stiffer, then when one changes a position from lying to standing, the more likelihood to have dizziness, and particularly in the face of medications, and so we would have to be careful, of that. So I'm going to summarize here. One is a concept of lifespan versus life expectancy. Do you know the difference in these concepts? This can be confusing when persons talk about what it means to be old. So lifespan is just the maximum number of years that any given species will live, right? And it's actually fixed, right? So the maximum lifespan for humans is somewhere maybe between 110 and 120. You can debate that. There are persons who've said they've lived to be 140, 150, but when you check those records, the records are kind of funny, where the persons may change what they say is their age, change it by 10 years when the records show that only 3 years occurred. So, you know, but based on good evidence, we're talking about lifespan of maybe 120 years. Life expectancy is something different. Life expectancy refers to number of years of life remaining from some starting point. So the life expectancy at age 0, at birth, is on average what for African American women? Life expectancy from birth. 80, not from birth. See, that's why we have to say, on the other hand, if you have somebody who already got to 65, and you say, what's the life expectancy moving forward from age 65, then you're going to have, you could have another 15 years. But life expectancy from birth for African American men is only in the mid-60s. For women, it's higher. The reason why it's not as high for African American men and women as for some other ethnic group is because all sorts of things that happen in youth, that happen prenatal care, what happens during the teenage years, those things expect future life. Why am I talking about life expectancy? Because for persons who have cancer, they've already gotten through those teenage periods. They've already gotten through, they say somebody who's 65 or 70 with a cancer, if you remove the significance of the cancer, that person may have a significant number of years of life remaining. You know, life expectancy from age 70 could easily be another 20 years on average. So even though the maximum lifespan is fixed. Let me talk about some of the aspects of successful aging that you all talked about, and I wonder how you think of these in your life and in persons in your families and in your community. So one thing that's important to many persons is having control of one's own life. So my father-in-law passed away with lung cancer about 12 years ago. And what was most important to him throughout his illness was that he had control of his own life, that he was still the one in charge, that he was going to make decisions about what doctors he saw, what medicines he had, whether or not he wanted to take pain medicine, how much pain medicine. His independence was his main control. So I'm curious how you think about those factors, though, that allow you to be independent. And one of them is physical ability. For example, musculoskeletal, your joints, your bones, your neurological system, necessary to be independent. Of course, cardiopulmonary, so you have exercise tolerance. And medications, taking just the appropriate amount and duration of medications. Mental capacity is important also. I refer to cognition and mood and use two terms like depression and dementia. These terms can be confusing in our communities, I find sometimes. And I wonder even how you define them. The word dementia, what does that mean to anyone? That was a joke. She said, I can't remember. Did you hear that? That's a good one. What is dementia? So it's confusion, the word confusion was used, the word memory was used. Dementia is a descriptive term, right? A succinct definition of dementia is loss of cognitive or intellectual function of sufficient ability, loss of those functions to the extent that that loss interferes with social occupation or functioning. So the importance of the definition is not that just that there's some loss, but it's the magnitude of the loss. So dementia is not normal with aging. Dementia is a disease. Dementia is a descriptive term for many different diseases. The most common one is Alzheimer's. That's one cause, and it is the most common cause of dementia. But it's not normal for persons even in their 80s to have dementia. They may have a little bit of loss of intellectual function. They certainly don't retrieve information as fast. I mean, I'm not in my 80s, but I don't retrieve information as fast as I did 20 years ago. And I don't know if any of you noticed that yourselves when you're trying to remember something and you say, I know I should know the answer to that, or I knew it, but I can't remember the name, or something you can't remember. That's what we mean by dementia. But here's an issue. If you have someone who has, somebody who has cancer, say they have a lung cancer, and they're living alone and also have just a mild degree of dementia. Even a mild degree of dementia in combination with a cancer and any complex illness really is going to require the need for someone like a family member to be an active part in that person's care. So one of the things that we're very mindful of in geriatrics is the significance of the caregiver in assisting persons, even assisting them navigate very complex systems, the kinds of treatments and visits that you've probably been hearing about today and that you'll hear about the rest of the day. Just navigating these systems can be complicated for a person to do alone, even a young person, but let alone an older adult. Why is depression important? It's because we know unequivocally that depression increases in persons who have cancers. Persons who have cancers are more likely to have depression than those who are not. And that depression in itself needs to be treated also. So let's not be afraid to do that. Someone at one of the tables talked about what I'm calling meaningful existence, like having a meaningful role in life, even while sick, and a meaningful role in life, in this case, while aging, spiritual fulfillments, the social relationships, either with family or friends, and then freedom from pain. Here's where I find in our communities, I wonder if you heard this, a fear of taking narcotics because of a fear of getting addicted to them. Have you heard that? Yeah. You know, I don't want to take pain medicine because I'm not going to take narcotics. The prototypical narcotic is morphine because of fear of addiction. How likely is it that somebody with cancer, lung cancer, an adult in this case, how likely is it that they're going to become addicted while taking morphine or some medicine like that? What do you think? I beg your pardon? How often do you think they're going to become addicted to it? It's not going to happen. It's really not going to happen. That's a myth, right? They're not going to become addicted to it. Addiction has a specific definition. It's a psychological dependence on some medication. And we see that sometimes in young people and persons who are not so much ill, but they have drug-seeking behavior. That's totally different from somebody who has a real disease and is taking it. So they're not going to become addicted to it. On the other hand, not just with narcotics, but with lots of other medicines, if you take it and then decide to stop it, it has to be withdrawn in a gradual process. That's not addiction. And that's just not specific to cancer anyway. There are lots of medicines where you can't just cold turkey and stop them cold. So the myth of addiction is something that we want to avoid because it interferes with freedom from pain and the discomfort and stress, restful sleep, food intake. I mean, persons who are in pain have their lives distorted in many different ways. These are some of the other problems that you're likely to see. Certainly problems related to atherosclerosis, other types of cancer. I mentioned these 4 types of cancer because in addition to lung, I think these are the big ones. So why are these important? Lung cancer is important because of all the cancers, it's the leading cause of death when it occurs. Breast and colon cancer are important because of a potential for prevention. I mean, we can really prevent these 2, or we can detect them early and do something about it. And prostate cancer I mentioned because, at least when I'm talking to men, and African-American men, it comes up a lot. It's the one that we kind of be fixated on. It's also one of the most complex ones because men can have prostate cancer and it never do anything significant to them, not the cancer. Particularly if you take somebody who's already 75, 80, and then they get to prostate cancer, they're much more likely to die from something else than from the prostate cancer itself. The arthritis, I mentioned the most common forms of arthritis, and then we had talked about dementia and depression a few minutes ago. Here's some issues of prevention that you should think about, even while persons have illnesses like cancer. One is in the area of the musculoskeletal system. The way to maintain that is through what? Someone said exercise, taking calcium. Do you know how much calcium a day you should be taking if you're over age 65? This is a number that you should know. Yes. You should be taking 1,200. That includes how much you get in your diet. So most people might get at least 200 in their diet. So you take another 1,000 or so, and you have 1,200. What about vitamin D? Why is vitamin D significant? One is, in a climate like ours in the Northeast, almost everybody's vitamin D drops significantly in the winter. And when your vitamin D level is low, it definitely affects overall energy. So this is something that can be corrected simply. Cardiovascular, what can we do? We talked about exercise again. I see one of the speakers today talked about smoking and cigarettes. That's clearly important for prevention. Taking an aspirin a day is protective for cardiovascular, particularly in men, and then diet you know about. How do you keep your brain healthy? There are 2 things you can do. It gets back to exercise, physical exercise, but also mental exercises. So there have been studies that have been done that show that learning a new language, dancing, ballroom dancing is one example. I don't know how many of you do ballroom dancing. I don't know anybody, friends or families who do ballroom dancing, but that was studied once. We do a lot of line dancing, and there's there must be 7 or 8 different types of line dancing. The problem with line dancing helping your brain, though, is often there's somebody standing up on a stage telling you which way to turn and what to do. So there all you're doing is listening and following instructions. But to the extent that you've actually memorized the steps yourself, then that type of activity is important for the brain. Also, so these are some solutions, what you can do to maintain prevent mental decline. Exercise, I talked about. People talk about antioxidants like vitamin C, or something called ginkgo biloba. There's not good evidence that those things really work. They won't harm you, but there's not evidence that they work. And last, cancer prevention. Again, this is in general, but very helpful. So let me change the focus in my last slide to something that I find troubling in the African American community, and that's misunderstandings about palliative care. Does the word mean anything to you, palliative care? Somebody tell me what it means. Anybody, is this something you've heard? What's that? So you said hospice. So here's where I want to make a distinction. So palliative care is the overall concept. It means focusing on comfort. This is in contrast to focusing on trying to cure something, to try to wipe it out, right? Now there's more than one approach to palliative care. One approach to palliative care is hospice. What does hospice mean? Somebody tell me. You say, what is hospice? Is it a place? Okay. What was said just now, that hospice is a type of care, and I do want to emphasize that it's a process. It's not a place, right? So in the United States, most hospice care occurs in the home. Hospice care can occur in a nursing home. Hospice care can occur also in a specific unit, a kind of bed unit that's set up just for persons who have life-threatening illness during the last stages of their life. So but hospice is not a place, it's a process, it's an approach to care. That's number one. Number two, technically what hospice means is that you signed up for a benefit program. So it's a specific way of delivering palliative care. Hospice is one approach to delivering. It means that there's a team. On a hospice team, there are home health aides, there are doctors, there are nurses. Those are the chaplain, social workers. So there's a team involved, and that team is what you're eligible for if you sign up. If you are eligible for hospice, you get that benefit program, but that's not the only approach to comfort. In the Philadelphia area, some persons can get palliative care through, for example, what's called Caring Way. Caring Way is kind of a home health program, which means you're not signing up for hospice, but you are signing up for in-home care provided by a staff that has particular expertise in end of life. So it's a subtle difference, but it's a real difference. Again, the emphasis is on comfort care. I think the last point that I would have you take away is you think about, for example, caring for your loved ones. Do some of you here have relatives or friends who have lung cancer? And you haven't? So what we think about is what's important to your future. What's important when you think about your future? What's most important? I mean, that's a key question. And that can change over time. What's important for many of us is to live more years. But not just living to be living, but to live more years with a high quality of life, right? So I find that in discussions about palliative care and comfort, the notion of focusing on what's important to the future can sometimes be fuzzy. And the last issue that I would bring up in our community, it comes up in the communities and families, and that is the need for you to be the focus of decisions, you being persons with cancer, in this case lung cancer, being the focus for decisions about your life, in contrast to getting lots of other issues confused by family members who become part of the system. So those kinds of issues sometimes include guilt. It includes competition, like competition among children as to who. That's nerve-wracking. Yeah, it is. It is. So you need, but one way to prevent it from being nerve-wracking at the end is to have discussions in advance. I mean, that's what an advance directive means. It means you had discussions in advance so that there's understanding about what your wishes are and what you don't want or what you do want. And there are lots of assumptions that are made, but those assumptions can be brought to light and clarified if you just ask for, really ask for your family members to participate. Yes?
What about putting it in writing?
Putting it in writing, the question was, what about putting it in writing? Putting it in writing is great, right? You need to put it in writing. You need to put in writing what your wishes are. But you also need to have a discussion, because sometimes what's in writing is confusing. The most confusing word that I see in advance directives, and this can be frustrating for me as a physician, is the word terminal. So you'll see something that says, I do or do not want something done if I am terminal. What's terminal mean? I mean, it's not a helpful term. You think about persons who have heart disease, cancers, Alzheimer's disease, almost any disease, Alzheimer's disease is not curable, but when does it become terminal? So it's not helpful. What should be made clear is putting in writing under what kinds of conditions or quality of your life would you want certain things done or not done, right? That's really the question. And then here's the other, what I find the other point of confusion is, who will speak for you if you can't speak for yourself? That's what we call a surrogate. And choosing one person, this is hard to do, because you may have 2 children, or 3, or 4, or 5, and the assumption is that they're going to all get along, we're going to all get along, but you need to choose one person who's going to speak for you and make sure that person understands. That helps minimize the confusion. If you actually put in writing that this is my spokesperson. You need to choose somebody who's willing to accept that responsibility, though. I remember I was in a nursing home helping out a friend of mine about a year ago. One of the colleagues, one of the younger doctors who was working with me, and when I went in, and the nurses said right away that there was there was a woman on dialysis who was very ill, and they wanted to know whether to send her to the hospital. She had come off dialysis a week before that. She had said she did not want any more dialysis, so she had voluntarily stopped. But of course, if you need dialysis and you stop it, then that inevitably will lead to death. 2 of her adult children were there in the nursing home, and one of them wanted to send her to the hospital, and the other one did not, wanted to respect her wishes. It turns out neither one of them had power of attorney. That was a grandchild. So I got everybody in the room, including the grandchild, who had the power of attorney. And the grandchild's contribution to the conversation was to say what? The grandchild's contribution was to say, I want to do whatever, I'm going to do whatever the kids decide, even though this was the person who had the power of attorney. So the person who had the power of attorney was really abdicating his responsibility. And the 2 kids were 180 degrees apart. One of them wanted one thing and the other one wanted just the opposite. So be careful about who you choose to be your spokesperson if that person is not willing to do this. Here's the summary of what we talked about. Exercise a lot, diet, certainly tobacco use. Being mentally healthy and spiritually healthy is as important as anything I can think of. The environmental quality is partly a function of your family and having supportive and meaningful relationships. Thank you. Any questions about anything? We got started a little late, and I think on the program we were going to end here at 1:20, but if you have any questions, feel free to ask.